Side effects of androgen deprivation therapy. My name is Dr. Nayak. I'm a urological oncologist here in Canada and co-founder of Men's Health Clinic Manitoba. And prostate cancer is something that I treat very regularly and in high volume. If you know someone who has prostate cancer, hormone therapy might have been something that's come up. Often this is administered with a needle injection into the belly fat. Sometimes it's a pill. But what is it and what are the side effects? So research from many years ago showed that testosterone is like food for prostate cancer. And so hormone therapy, and specifically androgen deprivation therapy or testosterone reducing therapies, are medications that are designed to reduce testosterone levels in the body and try to cut off the food supply to prostate cancer so it doesn't grow as much. If you're taking androgen deprivation therapy, it's important that you're aware of some of the side effects that you might experience. The best way to think about how androgen deprivation therapy could give you side effects is to think about women and when they go through menopause. So you might experience things like hot flashes, mood swings. Sometimes you can gain some weight, particularly around the midsection. You might even notice that you're not sleeping as well. Your mood is a little bit reduced. And this is all because the testosterone levels are going low. In addition, when the testosterone levels are low, your libido or sex drive will also be reduced, and that inherently can cause some erectile dysfunction. Depending on the intent of the androgen deprivation therapy, some people are on it just for a few months, some people are going to be on it for life. That duration is going to be more dependent on the status of your prostate cancer more than anything else. But the longer you're on androgen deprivation therapy, the more at risk you are getting some of these side effects. And if you're on it for a really long period of time, there is a potential that you could be at increased risk of cardiovascular disease as well. And as such, it's going to be really important that you still see your own family doctor to have your cholesterol levels checked, your blood pressures checked, and just to try to eat healthy and try to stay active to counteract the risk of these side effects. One thing to also clarify is that hormone therapy is not chemotherapy. So we are merely trying to reduce the body's testosterone production to slow down or halt the growth of prostate cancer. So it's very easily administered. You can be working while you're on it. And for a lot of people, you can maintain and preserve your quality of life while you're taking the therapy. But the best thing for you to do is to eat healthy, stay active, exercise regularly, particularly resistance therapy if you're able, and just move around. If you can do those things, you'll likely do really well with hormone therapy. Now, if you have questions that weren't answered in this video, or you've thought of something that maybe we haven't thought of, just leave us a comment. We'll try to do our best to answer it, because if you're thinking about it, somebody out there is also thinking about it too.